Some thoughts today from Sue Ricks and the Sue Ricks Academy about if you've got any back pain, back discomfort. So the first thing that I need to say is if you're poorly and you're hurting and you need any medical advice, please make sure that you see your GP medical practitioner. This is information that I'm going to put up is about some reflexology techniques, some hand reflexology techniques that you can do to see what difference it makes. And I'm also going to be covering about some of what the emotional and the metaphysical meanings, mind-body things that also might be involved. So the reflexes for your hand is down here, yeah, and this is the spine, the spinal reflexes. So if I show you on this chart here, going down here, this is the reflexes for your spine. So this is the top of your spine. So this is like your head, and this goes right down to your bum, and this is where the spine goes all the way down here. So I've been asked about somebody who's got some back pain, and the back pain is right down at the base of their spine. So that's going to be right down here. And I'm holding up my left hand because a lot of the pain and discomfort in the person who's been talking about it is on the left hand side. So if the pain's on the left hand side, you work mainly on the left hand, although you do both. And if it's mainly on the right hand side, then you'd work on the right hand, but you'd still do both. But the main focus would be left hand side discomfort, left hand, right hand side discomfort, right hand. However, having said that, every rule is there to be broken, and sometimes you can feel that there's some changes, and that is on the opposite side to what you expect. And that's where we get what we call a crossover. We don't know when they happen, we don't know why they occur, but they occur. So if you've got discomfort on your left hand side, work as I'm going to show you down here, and then check it out on the right hand side and see which side you feel more distortions on. Now when I'm talking about distortions, I'm talking about we're going to use some gentle touch reflexology techniques. So the clue's in the word gentle touch. So we're going to be doing a very gentle touch. We're not digging, we're not prodding around, we're not delving in, we're not doing anything unpleasant. It's just a very simple movement. So we're just going to work down. So really gentle, light work all the way down to the side of your hand. So it's down the bony ridge, down the side of your hand, right? And then the base of your spine is here. So this is the top, this is your head, and this is right down here is your bottom area. So just above there. So often when you've got some discomfort, you'll be able to feel it somewhere around here. So I'm just moving my hand around so you can see. So somewhere around here, it might feel a bit what I call squelchy, a bit sort of puffy, a bit splodgy around here. And particularly if you've hurt yourself recently and you've got some inflammation, it might even look a little bit pink around this area here where the discomfort is. So we're going to work down, just go really lightly down the side of your hand until you get to any area that feels uncomfortable. And if you find an area that feels uncomfortable, and I'm just imagining that maybe if you've got some pain in your back, it might feel a bit uncomfortable somewhere around here, or it might just feel different in a way that you can't explain. So Jen, just hold your finger on that area, no digging, no prodding, no delving. Just hold your finger and almost imagine you've got like a laser gun, so your finger is like emitting light out of your finger, and then it's almost as if you could talk to your back and just go, I hope you feel better soon. Just do a little bit of work around that area, right? And then just hold. Now if that actually feels uncomfortable, and for a few people it is, if you're really sensitive, if you are a sensitive person, it may be you need to be like doing virtual touch. So I don't know whether you can see it's like air in between your hand, and you might be able to feel that's particularly if you're actually doing this level of touch to somebody else. So just that level of touch that feels okay, no going in too far. So one of the things about pain is where there's too much energy that's gone along and it's like hit a dam. Yeah, so it's sort of like, ooh, trickle, and they go, oh damn, there's a blockage. Right, so it's a time to be caring and nurturing, and maybe a bit of self-reflection and finding out and thinking about, so what have I been putting myself through, what's been going on, what things are happening, is there something I'm dealing with or resolving. Sometimes pain down here could be to do with money worries, because this is to do with all the area, if I show you on hand reading. So this all area across here is to do with family and security and communication. And if I show you going down here, it's to do with thoughts. So it could be thoughts about family and security, or family and security and communication, depending on where that area is that's causing some discomfort. So it's about holding your finger and just keeping it on really light, doing a little bit of moving and soothing, and almost as if you could talk to it and wish it better. Do exactly the same as on the other hand. Yeah, just take your hand down and just work down the other side. And I say, you might feel that it feels more on one side than it does on the other. Then I also want to then say, if you've got some back pain, if we could see the rear view of this person with this is energy and this is chakra. So this is your base chakra, and very often back pain is about here. And it can also be associated also if you've got the menses, which is when there's a challenging time that's happening, so you've got a lot of internal things that are going on. And it may be all about, children not wanting children. So a lot of menstruation problems happen, which can cause extra back pain. And people are like, oh, a lot of, do I want kids? No, I don't want kids. Or I wanted kids, but I can't have them, or whatever. So that sometimes back pain can be aggravated by that. This area here is the sacral area, which is like, who am I, what am I, why am I, what's the most important things in life. And then this area here is again to do with practicality. So the root and base chakra, this is one of my charts, as all of these charts are in my chart pack. Right, and so it could be that it's to do with the root and the base chakra, which is about practicalities. So sometimes your back hurts when there's some practical issues. I'm here on earth and there's something practically that I'm dealing with and it hurts. So there's a lot of energy that's flowing, but it's not finding it very easy to move on. So sometimes really simple techniques, like trying to do your very, very best to just go in and down. If you look up on YouTube, you'll see I've done another video which is called In and Down. Just be like in and down, and find yourself just sitting quietly and peacefully and flowing through. And maybe you're remembering that phrase, it is as it is. And maybe it's time to take some time out and just to appreciate and understand and nurture and cosset. And maybe it's just a time just to be in and quiet, and have some time to love yourself and be cosseted and quiet. But this is the reflex area, going to go down your spine here. If it feels as if it's a bit sciatic-y, then that's across that area there. But this is the area. If it's left hand side, go down here, right hand side, go down here, but always check them both out. So if you've got a bit of a back problem, bit of back pain, that's a little bit of insight into some of the things that it might be about, emotionally, metaphysically, and some of the things that you can do something about. Always remember, if the pain's really causing you pain, this solar plexus area, just a really soft, gentle touch here helps you to manage pain a lot better as well. So if you need medical help, make sure that you go and see your doctor, your medical practitioner. If you think there's things that you can do for yourself, there's some nice tips, and just some very gentle stroking all the way down is just something that's just gorgeous anyway. So lots of love from Sue in the Sue Ricks Academy,